Okay, so well done, Dr. Wali. It was a good effort. How do you think it went? What are your thoughts?
Much better than the previous one. Yeah.
Okay.
Yeah, I would say good. Yeah.
Okay. So any thoughts about what you did well?
I think not pretty well, but at least I tried. Yeah.
Yeah. Okay. So there are quite a few things that you did well. I could see at the beginning again. You asked an open question. You asked a couple of open questions before then going into your Socrates, and then trying to ask the red flag type of symptoms that you would with abdominal pain. And they were specifically, you asked about fever, you asked about bowels, you asked about my weight, appetite. You asked about diet, but we'll come back to diet in a minute. So I could see there were, you were trying to, I think, go through a list of differentials, isn't it, with your questions. And then you forgot past medical history of medication, but you came back to it. So it's okay. It happens sometimes. It's important to try to keep that data gathering part, try and do it all there, and then do the management separately. But you did ICE this time, which was good, which you didn't do in the last consultation. And so the patient didn't really have any specific worries. He was just worried that he's got some kind of condition, doesn't know what it is, and he wanted some to find out and get some advice, isn't it? So you got that out of him, but there wasn't any specific worries about anything serious or anything like that. Okay, so you did you explored psychosocial part of things. You asked about habits. You asked about diet in particular, which was obviously quite relevant here to abdominal pain. And you were trying to link it all together. Just before we go on to the management part, what were you thinking as the likeliest problem here?
I think it might be inflammatory bowel syndrome.
Sorry, inflammatory
bowel syndrome.
Do you mean inflammatory bowel disease?
Yeah.
Or do you mean irritable bowel syndrome?
Oh, I think it's irritable bowel syndrome.
Irritable bowel syndrome. Yeah.
IBS, yeah.
Yeah, IBS, yeah. So inflammatory bowel disease is like Crohn's and UC, osteocolitis, isn't it? But you were thinking irritable bowel syndrome. Yeah, that's good. Well, what made you think that?
Because the pattern of it's constipation and diarrhea. So, and you told me that you are eating vegetables and all this, and still you are having constipation and diarrhea, sometimes constipation. So that might be one of the cause. And apart from that, there was no any other. I would say I couldn't think of anything else because no weight changes, no
blood in the stools.
You asked about no vomiting, diarrhea, nothing else. Okay. So I could see there was no yellowish discoloration of the skin, nothing. So on examination, I couldn't see anything.
Okay.
So lots of different.
All right, good. Yeah. So inflammatory bowel syndrome. Sorry. Even I said irritable bowel syndrome. You're thinking along the right lines, but the things that pointed to it, as you correctly said, so there's a variation in bowel habit in terms of sometimes loose, sometimes normal, sometimes constipated. But there were other clues as well. So the pain came on after meals, which is quite classic, and it was relieved by opening bowels, which is also quite classic. And you rightly said there wasn't any blood in the stools, and there wasn't any other symptoms like fever, weight loss, and all of these kind of things. So you were actually on the right line. Irritable bowel syndrome was actually the right diagnosis. Couple of things I want to point out again, just when you were moving to the examination part, you mentioned temperature, blood pressure, and pulse, which seem to be, I think, your three favorite ones. Maybe a couple of the others again maybe wouldn't have actually been that necessary, but that's fine, because blood pressure and pulse would have told you if the patient is hemodynamically stable, and fever, so that's fine, no arguments with that.